So good morning. Already busy at the track in Caulfield. Not a great start to the day. Just had a quick look at a horse that had a bit of swelling and heat in its fetlock joint and pastern. Now the horse is sound at the trot. No real effusion of the joint, so no swelling of the joint capsule or anything like that there, but there was some heat in the leg. And that's often a cellulitis, so you've got to be careful of your greasy heels at the minute. Deal with that, dry it up, get it treated, because it's an easy access for infection to get in that way. So that was all done, and then just unfortunately had a look at a horse with a tendon injury. Never good. So how do you pick up a tendon injury? First thing, mythbuster here, they're often not lame. Okay, superficial digital flexor tendons in a front leg in a racehorse, rarely are they lame. You got to look at the clinical size. Is it hot? Is it painful? So the best way to palpate it, I'll try and do a video in today actually. I'll try today. How to palpate a tendon. You lift the leg off the ground, the knee slightly flexed, and with gentle pressure, it's like squeezing a tomato. I think a tomato would be a good way. Squeezing the tomato, you palpate it, and if you get a pain reaction and it's repeatable, you got a problem. Need to scan it, have a look at it. So yeah, I did that there, and unfortunately it's got a big hole in its tendon. Bit sad. So we'll write a vet report, which I seem to be doing more and more of these days, writing vet reports. I think it's a good thing to communicate with owners. It's an issue we have sometimes in racing, the breakdown in communication between vet, trainer, owner. Sometimes it literally goes that way, and the vet and the owner don't communicate. So writing a vet report's a great way to do it. I love them. I put the ultrasound images in them so you can see them. I'm really comfortable with the really nice images we get, and I think it's really important for people to get a visual. So picture says 1,000 words, as they say. So just in next big stable, we've got a really busy day today. So I'll talk you through some of the things we got going on later in the day, and we'll speak later. Goodbye. So, this morning so far, my day's going to pot, to put it bluntly. If there's ever a reason why your equine vet's usually late, it's because we've had a drama. So, I'm waiting for a horse that was on the way to the races, that's had an accident in the float, to come round and come back to Caulfield. So, we'll see what damage it's done. Doesn't sound good. It sounds like it'll be a bit of work, so we will work on it from here, and that's why I'm running late today. So it's going to be a long day. So I do apologise to all clients, but this is usually why your vet's running late. It's usually a drama's happened, or just while you're here, can you have a look at this one? So yeah, we'll just wait and see. Bye. So just finished the day, managed to get caught up with everything. Did a lot of tendon scans today, so might just put a video together of what we're looking for in a tendon scan. Couple of horses, one had a tendonitis that we've been monitoring the last sort of few weeks, and it's improving. So what's tendonitis? Tendonitis is inflammation of the tendon. It's a major injury to the tendons, so often they can respond really quickly and we can get them settled down. But you've got to really back off the work and give them the time and anti-inflammatories, and then rescan them. They're a little bit of a cautious approach. They need a little bit more management and following up with ultrasounds, measuring cross-sectional area and also the tendon fiber pattern. So did that there, and then this afternoon did a couple of lameness exams on racehorses, a little bit of knee pain, which is pretty standard, and then vet checked a really nice 2-year-old, x-rayed some stifles and hocks on a 2-year-old warm blood. Really important to check for OCDs when you're buying a young horse. I know some people say, oh, you don't need a vet check. But the problem is when you get a stifle lesion, it often requires surgery and can be career limiting straight off. So I think it's well worth investment for young horse, because you're looking at, for stifle surgery, some of the stifle OCDs, you can spend $3,500–4,000 to get them done. I know I sent a young thoroughbred weanling off about 6 weeks ago, and the surgery time was 3.5 hours to clean it up. So it's a big surgery, not quite an expensive surgery. So it is something you want to just check, make sure it's not there. don't want to x-ray folds too early. You really want to be about 18 months would be ideal, because then you've got what you've got. It's generally not going to improve. Some may improve, but the general, if you're going to take a general rule, they need to have surgery early. So anyway, have a great weekend. I will put together some ultrasound images, I think, and talk you through them, what we're looking for. Cheers, bye. So, normal appearance of an ultrasound, normal appearance of tendons on ultrasound is something often people comment they're staying, they don't know what they're looking at. So I'm just trying to break it down for you, just to sort of give you a guide. At the end of the day, we assess them quite routinely, and you have to be aware that we can pick up subtleties of changes which are something that need to be addressed. So let's start. Superficial digital flexor tendon, that's the most common site of injury in a racehorse. So what we're looking for here, this is superficial digital flexor tendon. When people talk about bowed tendons, this is what they're talking about, injury to this region, most common in reventers and show jumpers. Then we've got the deep digital flexor tendon, which runs right down and inserts on the pedal bone. You've got the check ligament here, which will insert onto the deep digital flexor tendon, and then we've got the suspensory ligament down here. This is your cannon bone down here. So 4 major structures that we have to be aware of in the foreleg. So superficial digital flexor tendon is probably the most commonly injured tendon that we see within our clinic, due to the high percentage of racehorses and event horses we do. A couple of things you need to understand about a superficial digital flexor tendon. It reaches maturity at 18 months of age, so it's old age from then on in. It works at a full gallop, it's working at about 99% capacity. So what does that mean? That means that any micro damage to that tendon just predisposes the horse to more injury and a proper tendon injury. So you have to be very careful how we look after our horses to ensure that we maximize their lifespan and reduce the chance of tendon injury. So there's not a lot of spare capacity. As I said to people, if you're an engineer, you probably wouldn't be, and you designed the equine superficial digital flexor tendon, you probably wouldn't be asked back again, because it's the most common place we get an injury. So there's 2 types of tendon lesions within the superficial. So you see here, we've got an image, we've got a nice core lesion. So it's very central, it's within the tendon, most likely caused by exercise, and we often talk about a hole, but it's not really a hole, it's a hypoechoic area within the tendon. You've got hemorrhage in that area, and you've got damage to the tendon fibers. Then we get the peripheral lesions, which, as you can see here, the arrow highlights that these are most likely caused by trauma. So it's a horse being hitting itself, or getting its leg over sitting over a metal bar or on the float. So it's something, we get those, they're very different to the normal central lesion, but they can be just as difficult to deal with. Then we've got the deep digital flexor tendon. So this runs all the way down the back of the cannon bone, down the back of the fetlock joint, and inserts on the pedal bone. Most likely in our practice we see these injuries within the foot hoof capsule, so we don't often have ultrasound changes on that area. Occasionally we'll get a pastern lesion, but most of the time it's within the hoof capsule and we need to diagnose those via MRI. So, check ligament. Check ligament, we see this injury in dressage horses quite commonly, and it inserts on into the deep digital flexor tendon. You may have heard people call check ligament desmotomy. So we cut that there when we want to release pressure on the deep digital flexors, such in cases laminitis. Most of the time we deal with them. They will show up as lameness, and there'll be swelling. So there'll be puffiness behind the cannon bone, there'll be sore to palpate, and you need to be aware of them. So suspensory ligament has actually got multiple parts to it. We break it into 4 parts. So you've got the proximal attachment, so that inserts behind the knee, between the splint bones onto the cannon bone. Then that runs into the body of the suspensory, and then it breaks into 2, and you've got the inside and the outside branches and inserts on the sesamoid bones. And then you've got the distal portion, which the sesamoid bones are part of, and that they insert on the pastern. So you get puffiness in the pastern, you've got injury in that area. Proximal suspensory, it's just behind the knee. The best way to palpate it is lift the leg off the ground and gently push your thumb in between the tendons and the splint bone. If you get a pain response there, you have to assess it to the other side. They will cause lameness. So a lot of tendon injuries are sort of myth bust. Superficial digital flexor tendons often won't cause lameness. Deep digital flexor in the foot will cause lameness, and suspensory body and branches will often not cause lameness, but will cause swelling. But proximal suspensories will definitely cause lameness. So in severe cases, they'll pull off the back of the fetlock joint. Your suspensory body, it's right at the bottom of the here. We sort of see injuries of those there. Quite commonly, we have to assess it because often when we've got an injury to the body, it will run into the branch as well. And we've got to check the inside and outside branch when we scan them. And you get a lot of swelling in the region. It's quite obvious to pick them. They're very swollen. They're very sore to palpate. Then your branches. Remember, you've got two branches. You've got an inside and outside branch. Most commonly, in a galloping horse, the inside branch will go because that's where most of the pressure's going. Can confuse it sometimes with joint swelling. So if you've got a horse with puffy joints, sometimes you can be a little bit slow to pick these up. So you need to be palpating them, and they are sure to palpate, but they're often not sore. So take home message: if in doubt, check it out for any swellings. And yeah, I've got to go here. It sounds like the phone's ringing. Bye.